Welcome back. In today's video, we are going to discuss about the changing concepts in public health as a continuation of a chapter Man and Medicine. World Health Organization defined health as a state of complete physical, mental and social well-being. So, physical health implies the perfect functioning of the body. Here, the functioning of the organs will be at a optimum capacity. And the mental health means there is a balance of the individual with the surrounding world. He is mentally healthy person will be well adjusted. He doesn't get easily upset. He has his self esteem. He has his goals and needs in his life. So the mental health is also coming under the health definition of health. Social well-being, what do they mean by social well-being here? Social well-being is the social functioning of the person, his ability to see himself as a member of the society, his interpersonal relationships with the people. All such things is health. It's not just the absence of disease. Now if I'm not suffering with the disease, that doesn't define that I'm healthy. He should have a physical, mental and social well-being. I hope the definition of health is very clear. Let us also go through the definition of public health and then understand the changing concepts. Public health is the science and art. It is the art of preventing the disease. So here you can understand the public health by three P's. So you can see here the public health can be remembered as three P's. Okay, the first one is you're preventing the disease. You're prolonging the life. By preventing diseases, what are you doing? By preventing the disease in a person, you're prolonging the life expectancy of that person. The number of years he will survive will be increased. And by this, you're promoting the health of the person. So, three P's for public health definition, and all these functions are carried out through the organized efforts of the society. The society plays a role in all these by the efforts of the society. That's the reason it is public. It is public health. Okay? I hope the definition is clear. Moving on to the changing concepts in public health, there are four concepts of public health. First one is the disease control phase. The the history of public health marks the four distinct phases. In the disease control phase, which took place in 1880 to 1920, the public health during this 19th century was a matter of sanitary legislation and sanitary reforms. These aimed at the control of man's physical environment, example water supply and sewage disposal. So guys, date back yourself to the 19th century and imagine the situation and conditions there. It was all about the sewage. It was all about the filth in the cities and towns, the slums and so on, what we studied in sanitary awakening. So we knew during the 19th century there was a need of sanitary reform in the first place. So during the disease control phase, a matter of concern was sanitary reform, and they aimed at the control of physical environment of the people. Example, the water supply, the clear pure drinking water to the cities, the water supply scarcity should be removed, the sewage disposal at its right place was the first step taken. These measures were not aimed at the control of any specific disease. Here, the aim of the people during the 19th century was not focused on eliminating any disease in the society. Rather, the main matter, the main focus was upon the sanitary legislation and sanitary reforms. However, these measures, they indirectly, what did they do? They vastly improved the health of the people. They improved the health of the people due to the disease and death control. By bringing in these reforms and changing the man's physical environment, bringing a control in his environment, also controlled the disease and the death. I hope the disease control phase is clear. Now let us see the other concepts. We have health promotional phase, which is given in 1920 to 1960. Third is the social engineering phase, which is 1960 to 80. The last one is the health for all phase, which was in 1981 to 2000. Starting with the health promotional phase, which came into act in 1920 to 1960. At the beginning of the 20th century, a new concept of the health promotion began to take shape. Okay, during the 20th century, guys, the health promotion started. What did they do? In addition to the disease control activities, one more goal was added to the public health, that is, the health promotion of individuals. The health promotion of individuals was initiated by mother and child health services. To improve the health care of the individuals, this mother and child health services began. School health services, industrial health services, mental health services, and also the rehabilitation centers and services were started. So during the health promotion phase, they aimed at improving the health of the individual here. In the control phase, it was just the physical environment they were focused upon. In the health promotion, the main focus was upon the improvement of the individual health by initiating various types of services. Since the state had assumed a direct responsibility for the health, two movements were initiated. And also, the CEA Winslow defined the public health as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of society, which we have already discussed. It was given by CEA Winslow. So I told you about the two great movements which were initiated by the state, that was the provision of the basic health services. The primary health centers and sub-centers for the rural and urban areas were developed. This was an important development during that phase, that is, the primary health center came into initiation. The second important step, the movement which was initiated, was the community development program, which came into act in 1952. It is an attempt to bring about a social and economic transformation of the village life. It is with the involvement and efforts of the people themselves. Through the active participation of the whole community, this village was developed. This is the reason it was termed as community development. The whole community took part in it and developed the whole community. See guys, this is the community. The active participation of the whole community was for the development of its own. This was the step taken during the health promotional phase. Moving on to the third phase, that is social engineering phase, which came into act in 1960 to 1980. Now, with the advances in the preventive medicine and also the practice of public health, the pattern of the diseases began to change in the developed world. So we got to know that there is a so now here we see that there is an advancement in preventive medicine. So the prevention of the disease was at its peak, and the public health was started into practice. Like we discussed previously, the whole community was taking an active participation. Primary health centers were brought into act. So many services were provided to the children, to the mother, and all such practices of the public health, and also the advancement in preventing the medicine got a change in the pattern of disease. What was this change? Many of the acute illness problems were brought under control. All those acute diseases which had the sudden onset were brought, and short interval. The acute diseases will have a sudden onset, short interval of time the disease will be, and it will resolve or it will lead to death. This pattern changed and the chronic diseases began. New health problems took the face of chronic diseases. These chronic diseases started emerging in the societies such as cancer, diabetes, cardiovascular diseases, alcoholism, and drug addiction. Especially these things were more in affluent and upper class societies, and because of these problems, a new concept of risk factors as the determinants of the disease came into existence. Now they started a new concept called risk factors. The risk factors were nothing but the determinants of the disease. The consequence of the diseases, unlike the death by acute infectious disease, was, so guys, here what they're saying is, in acute diseases, the acute diseases will result in the swift death. Acute diseases will result in the swift death. Whereas the chronic diseases got a chronic burden on the society. So this was the change in the pattern. You're understanding, guys? The acute diseases were brought into control. The acute diseases were brought under control. What is the consequence of acute disease? It will lead to death, swift death. Whereas the chronic diseases, they were a burden to the society. It was like a heavy weight, a burden to the society. These problems brought a new challenge to the public health. This public health had to reorient itself towards the more social objectives. So now here the problems brought a new challenge to the public health, and this led to the entry of a new phase, which is nothing but the social engineering phase. In the social engineering phase, new priorities have been given to the behavioral and social aspects of disease and health. Now, they want to know what is the cause behind these chronic diseases. So, the priorities now change to the behavioral aspects, to the social aspects of the people. Public health moved into preventive and rehabilitative aspects of chronic diseases, and also the more focus was moved on to the behavioral problems of the society and the people. So you can see more focus was on the behavioral aspects and also the occupation, the smoking, tobacco, family history, radon gas, aging, other illnesses, pollution, exposure to radiation. So the main focus was moved on to these behavioral aspects of the society, social and behavioral aspects of disease. These were given more priority compared to the acute diseases now, because they had got the acute diseases under control. Now the main burden to the society, the threat was of the chronic disease, and the social engineering phase focused more upon the social and behavioral aspects of disease and health. The last phase is Health for All, which came into act in 1981 to 2000. Most people in the developed countries and the elite of developing countries, they are enjoying the good health because of the adequate income, nutrition, education, sanitation, safe drinking water which is being available to the people, and a better comprehensive health care. So guys, now this is a comparison which is made between the developed countries and low socioeconomic countries. Health for all, it was pledged by WHO. Here what they're saying is there must be an equity in health. Everybody deserves good health. So there must be an equal balance in health services which are being provided to the developed as well as the developing countries. So this is a comparison being made here. They are saying that in the developed countries, people are enjoying the good health because of the high income, nice clean water, the good healthcare services which are provided there. Now, in contrast, in the comparison, you see the people in the developing countries, only 10 to 20% have a ready access to health services. What about the 80% is of the concern now? Only 20%, guys, this is so bad. You see here, only the 10 to 20% people are enjoying the health services. Death claims 60 to 250 of every 1,000 live births within the first year of life. So around 250 deaths were reported, from ranging from 60 to 250 out of the 1000 live birth in the first infant of 1 year of life. 250 children are being died. Life expectancy is 30% lower in the developed countries compared to the developed countries. Now you can see under the threat is the developing countries. The life expectancy is also reduced by 30%. So this was the contrasting points between the developed and developing countries. Large number of world's peoples, perhaps more than half of the people, have no access to healthcare at all. And for many of the rest, the health care they receive does not answer the problems they have. So guys, you can see here that the developing countries are facing a lot of threat. There is no health care. More than half of the world's people are not having a proper access to the health care. So in 1981, the World Health Organization pledged that the health for all will be provided by 2000 to bridge the gap between the developed and developing countries. This pledge, Health for All, is the last phase of the changing concepts of public health, which was in 1980 to 2000. This health for all was mainly leading to a socially and economically productive life. Now let us summarize the whole concepts. There was disease. The disease control phase came into act in 1880 to 1920. Okay. The main focus was on the sanitary legislations and sanitary reforms. Then the second phase we see is the health promotion phase, where the main focus was on the health promotion. So guys, recall the health promotion of individuals by providing various services and also primary health cares and community development. Then comes the social engineering phase, where the social objectives, like you have to describe about the change in the pattern of disease, and also they have given a more importance to the social and behavioral aspects of disease and health. Then the World Health Organization, the health for all phase comes in 1981 to 2000. This is to gap the bridge, they have to bridge the gap between the rich and the poor within the countries, and also between the developed and developing countries. So I hope the concepts of public health is very clear by now. And if you like my video, please hit the like button and subscribe to my channel. And if you have any doubts, put it in the comment section. Thank you.